Okay, the waiting room's cleared.
Good morning, everyone. Thank you for joining us. I'm Amanda Nelson, Long-Term Services and Supports Manager with the Office of Aging and Disability Services. I'm hosting this call today with several of my department colleagues. We'll introduce everyone and get started after we go through some housekeeping. First off, this meeting is being recorded and will be posted to our rate system reform website either today or tomorrow. We will put the link to the webpage in the chat. Please submit your questions with the Q&A function located at the bottom of your screen. So that we don't miss any of your questions, please avoid entering them into the chat. To make the best use of our time, we won't be discussing the overall NIF rate reform model or the rulemaking process today. This meeting is for providers, their billing staff, and their vendors to ask questions about the nursing component of the PDPM and claims billing. Any questions we can't get to today, we will follow up in an FAQ document, which we will distribute and add to the rate reform site. We'll now quickly introduce department staff in attendance today, and then we'll start with Q&A. Amanda Lee, do you want to start?
Sure. Amanda Lee, Rate Setting Coordinator for the Office of Care Services.
And Dwayne Parsons?
Dwayne Parsons, Manager of Rate Setting for the Department of Care.
And Bruce Cosgrove?
I am the Provider Relations Specialist for the nursing facilities.
Sue Panette?
Hi, I'm Sue Panette. I'm the Case Mix Manager and the State RAI Coordinator.
And Kathy McGuire?
Yes, hi, Catherine McGuire. I'm working under contract with the department on the case mix portion of the PDPM rate setting.
All right, thank you all. So Bruce will start us off by reading and answering some questions that were submitted in advance. Meanwhile, if you have additional questions, please either enter it into the Q&A section at the bottom of your screen, or you're welcome to raise your virtual hand by choosing the raise hand option at the bottom of your screen. Mandy will call on you in order of hands raised and send you a request to unmute your line so that you can ask your question. If you're participating by phone, please press *9 to raise or lower your hand and *6 to unmute or mute your line. Again, I will note that the chat feature is disabled to ensure we don't miss any of the questions. As a reminder, the purpose of these office hours is to answer questions specific to billing for the PDPM, so we won't be able to answer questions that are outside of that scope. We will answer as many questions as we can today, and any questions that we don't get to, we will answer in an FAQ document or follow up with you directly. Bruce, take it away.
Okay, good morning, everyone. And so we have had a few questions come in, and I'm just going to read off you. I'm not going to share a screen that you're going to be able to see them, but I'm just going to go off from what I have. We currently, the first one we have is the days of wait in placement. And should we continue to bill the days of wait in placement on the same claim on there? Yes, you're still going to bill if you are submitting a claim for that month or the days that a member is there. Nothing will change. Your days of wait in placement revenue code would still go on that same claim. And then will your days wait in placement days continue to be billed with the revenue code of the 0167? That is correct. That will still stay the same. The 0167 will be the and then we do have will this cause any issue with the billing and payments? Currently, there is nothing that would actually change or have any issues or interruptions with any billing or any payments. And we also have is there a sample of the UB sample of what the UB will look like for the PDPM implementation. Currently, there is not anything that is actually out there, whereas the only item that's going to be changing on your UB 04 is going to be using that revenue code of the 0022, and then you're going to replace your RUG code with your PDPM code. So there is no big changes for any of the UB04 claims. And that's going to also be the same with any of your electronic claim submissions that you are doing or formatting for your electronic claim file submissions. And then also I have the when will an updated 837I companion billing guide be available? The updated companion billing guide is in process as far as we know what's going on, and will be posted as soon as that is completed and updated. But like I had said, everything is actually staying the same for what you currently are doing right now for your 837s. You're replacing where the RUG code would be entered with where the PDPM code would be entered. And then currently, those are the current active questions that I have at the moment going through here. And so currently what I'm going to go ahead and do is pass this off actually to Susan on some of the items that are here for her to best answer.
Do we want to have Dwayne go through a rate letter example first, or?
Yeah, we can absolutely do it that way if he wants to pull that up and go through that.
Are you comfortable with that, Dwayne, or do you want to wait a minute?
I mean, I'm fine with it. I don't have one prepared right now, so I'll just have to pull it up.
Okay, yeah, Sue, if you want to go ahead, there's a question around, along with the rate letter question, there's a question around, do you have a HIPS code crosswalk for the PDPM HIPS generated by the MDS?
Okay, there is no HIPS crosswalk available. I will show you, there is a letter on the SMS, the submission management system for every single facility that shows all of your assessments that were submitted between 10/1 of 24 and 12/31 of 24. And for those assessments, the HIPS code is listed. You will take the middle code, which is the PDPM nursing group code, and you will use that code to be able to bill for services 1/1 and after.
How come I can't hear?
You can't hear me? Can anybody else hear me?
Yeah, we
Yeah,
can hear you.
Yeah,
Sue.
we
Oh,
can
thank
hear
you.
Sandra
I
just
just-
joined us. I think she might be having technical issues.
My speaker's not
Oh,
hooked
gotcha.
up?
Okay, I'm gonna mute you, Sandra, but we can hear you.
Huh?
I just want to pause for a minute.
I hit that.
Nope, you're on. Here we go. I got you, Sandra. I want to pause for a minute and see if everybody got what Sue was saying about the SMS portal, and see if anybody has follow-up questions from that. That is a new resource. It's not a crosswalk per se,
Oh, right there. I didn't know.
but
Okay.
it is a resource.
You give me just a minute, I'll pull up a copy. This one. Well, I'm trying. It's not. Okay, this is a copy of the report. This is an actual facility copy. And I have blacked out the facility name and the residents' names, but this is what the report looks like. If you go into SMS, go into, and you, if you do not have a password and login, then you need to contact Catherine Gunn at the Catherine Cutler Institute. She will set you up with a username and password. The SMS is the site where you have needed to go for many, many years to get your final validation reports. So you will find a list of all of your residents and all of the facilities. You can see here that this top one had an assessment reference date of 12/7, and here was the PDPM group.
Sue, we're not able to see what you're sharing. I think Amanda needs to make you co-host. I can't do it.
Okay, sorry, I didn't, am I able to share my screen?
You should be able to now, Sue.
Okay. I don't see it. Hey, there it is. Okay. Sorry about that. I'm used to being in my Zoom. Okay, you should be able to see it now. Am I correct?
Yes.
Okay. So this is what the actual report looks like that you will pull up from SMS. It says University of Southern Maine. It has a list of all of your residents. You can see that it has the list of all of the assessment reference dates going back to 10/1. And for each one of those residents, you will see the PDPM group. Now, I have prepared a document to go along with that, and I will share it at the forum call coming up on February 6th. But within this, and if you want a copy of this before then, please send me an email. It just describes this report a little bit, and it talks about the HIPS codes and what this number, some of them have a number, some do not. What does that mean? And what do you need to do on your claims? And you will see here that if you submit it as this number here, your claim is going to be denied. If you submit something with MHIE, it's going to be denied. If you submit MHIE 6, it's going to be denied. The codes have been set up so that the billing program will only accept AA, and the underscore here is the PDPM nursing group code from this list that's on there, and then an A6 at the end. So that is what is called a masked billing code. Questions about that? Are they able to ask questions?
Yep, they can. They
Okay,
can raise their
okay.
virtual hand. I don't see any questions
Okay,
specifically.
well, we will talk about it at the forum call on February 6th.
Yep, and if other questions pop into your heads about that, feel free to raise your hand or put them in the Q&A.
Okay.
But for right now, thank you for sharing that, Sue. Appreciate it. It's very helpful. We can go to one of our Q&A questions. Can you go over the bed hold policy and the rate each provider should be billing?
Yeah, the bed hold policy has not changed. It's still the same. The rate is still your room and board rate that you would be billing, just like you currently are billing with the same revenue code. Nothing has changed in that regard for the bed hold billing. So that should remain the same, and it's broken out with the room and board rate on the rate letter to give you that rate for billing purposes.
Thanks, Dwayne. The next question, can you please confirm that updated rate letters have been uploaded in the portal? Have issues with calculations been identified and corrected? Also, can you describe any claims testing for the new billing system that the department is conducting?
As far as the rate letters are concerned, yes, we have corrected a number of errors. We corrected a few more this morning with a couple providers, in which the chart on tier 3 had some errors in it as far as calculations are concerned. But most of those rate letters were sent last Friday to the portal to be uploaded, and there's been roughly 5 providers in which new rate letters were submitted to the portal today. But they should all be correct, and the calculation should be correct on those.
We want to thank oh, sorry, go ahead, Dwayne.
As far as claims testing the department is concluding, I'm not aware that the department's is for doing any claims testing, but we do know that Gainwell has been doing some testing on there.
Yep, we're moving closer to more and more claims testing. We are in the process of that. Like Dwayne said, our contractor Gainwell is in their process, and we'll be continuing work with them through the week. On the rate letters, we just want to thank everybody who did bring that to our attention so that we were able to quickly fix it. We did go through all of the rates that were posted to the portal in those rate letters. And they do align very well with the estimated rates that were shared in November, within a penny or two, which is a rounding error. So, and it looks like Dwayne's team has been fine tuning a little bit more, but we believe all those issues have been corrected now. So if you find anything else, please don't hesitate, let us know. We really appreciate you bringing that to our attention. The next one, can you clarify what you mean when you refer to the PDPM HIPS code? You mean the main care billing code with the masked digits would be billed with revenue code 0022 on the claim, correct?
Yes. The HIPS code will still be billed with the 0022 revenue code, similar to how the HIPC was billed previously.
I have a question. Hi, we're getting kind of mixed messages from our software vendor, and maybe the terminology we're using is a little bit different. So what the claim is to have the care level with let's just say AAIA 6. That's what you need on the claim, not the PDP, not the nursing PDPM score, correct?
You do need to have the PDPM nursing code on the claim.
With that masked code, right? Right,
Yes.
Sue? So the only character of the PDPM that's being used is the third character for the nursing component. The other components of the PDPM gets masked with the A.
Yeah.
And then the assessment type would be a 6 for an OBRA assessment at the end. So that's the 5th character.
So by any chance, does anybody have an example of a UBO4 that we can look at? So we can see exactly what we're supposed to, I think the terminology is confusing, at least what I'm trying to build in our software vendor and what the software vendor is dealing with also.
Who's your software vendor?
Software vendor we use is Point Click Care.
Okay.
Jen Watts, do you have any, I think and again, we have a lot of Q&A questions, and this is our second time we've been on with you. So, and we have concerns that because the software vendor is having us tell us different things than what you're telling us. And I think, Bruce, I had emailed you exactly what the software vendor had said to National Healthcare.
Yeah, that they got a duplication of the 0022. Though
Well, and again, that's fixable within software for us. But Jen is
so we just really want to confirm that when you say the PDPM HIPS score is going to be the 0022 line, is that the main care level? Is that going to be the AA, BA, the AACA, as opposed to like the HIUE?
Yes.
Yes.
Yeah. The
It's
mask.
going
code.
to
So
be a
that's where the
5-digit
confusion
code.
lied for us. So that HIPS score that we're entering on the UB is the main care masked score.
Correct.
Okay, thank you.
We would like to see vendors enter that code as a masked code at Z0250 if that is possible. Now, I know there's at least one software vendor on the call.
So this is Denise with Point Click Care, and I agree. I think just some feedback for kind of the audience is when I know using PDPM HIPS for you all is new, and so when you say the new PDPM HIPS code, in your mind, I feel like you guys are referring to that main care billing code. However, because providers have been using that code PDPM HIPS for a long time for Medicare, when you refer to it as the PDPM HIPS code, people think it's that CMS code, but what you've clarified to say is that it is the main care billing code that needs to go on the claim. And do you have, I know you mentioned also the MDS, do you have a timeline as far as when you want that? Or is it just as soon as possible when vendors can get that on there?
I would say as soon as possible, because we typically do not reach out to the vendors. We rely on the providers to reach out to vendors because there are a number of different vendors and their software programs each work a little bit differently. I am any provider, any vendor can reach out and call me or send me an email. My email address is suzanne.pinette@maine.gov.
Thank you, everybody, for the thoughtful questions and the clarification. It's helpful to have a conversation to get right down to what the questions really are. So thank you. I see another question on that topic. Can you share the document that Suzanne just covered to everyone on this call or post it to your website? I believe we will at one point, but we won't be able to post that yet. But I believe, correct me if I'm wrong, Sue, you're going to share information on that on your call?
I am, but that's not until February 6th. Send me an email and I will send you the document that I made, as well as I can even send you, encrypted, of course, a copy of your letter from SMS if you do not have a login and password. If you don't, you need to get one.
And they can reach out to Catherine Gunn for that, is that right?
For the username and password for SMS, yes.
Okay, so you should have the password and username to that SMS. But if you don't, that's through the Catherine Cutler School with Catherine Gunn. Should we maybe put that contact in the chat for folks? That email to Catherine?
Catherine's email?
I think that'd be helpful.
Yeah, I just wanted to ask, I'm sorry, my camera's off. I had a sneezing attack. Where do people sign up for the February 6th forum? Like, is there a notice that went out, or I just was wondering if there's a link to register, or it's just.
There is a notice that went out. Catherine sent it out to all of the nursing homes who have signed up to receive emails. Another reason why Catherine needs to be updated with all of your email addresses and changes, and you will get a copy of the document that lists all of the trainings that's coming up through the end of February, along with a link to register. And you will be notified of forum calls and trainings.
Thank you.
And Sue, we just had a request if you could also put your email in the chat, that'd be helpful.
Mary, there's a Mary Cessna has a question. Her hand's raised.
Hello, my name is Mary Cessna, and I am representing North Country in Maine, North Country Associates. I work for NetSmart Technologies, and we're their software vendor. So, Suzanne, this question is for you. We would need to email you to get confirmation that the state of Maine wants the score to be in the ZO250 for that development to occur.
You want me to email you something?
Yeah,
Is-
or
is
I
that
can
my-
email you and then you can email me
And I
back.
will
So,
respond, yes.
yes,
Yeah,
okay.
we will just need documentation from the state of Maine in order for our software to be able to code to that.
Yes, I will do
Thank
that.
you.
Thank you.
There's another PDPM question from Mary. The PDPM code on the claim, is that the mask code provided by MainCare, or is it the PDPM from the OBRA? I think, did we answer that already?
Well, there's sort of, it is the masked code. What needs to stand out is the PDPM nursing group character from the PDPM HIPS code. Does that answer your question?
So if we have AAIA6 or whatever it is on the claim, that's what you're looking for, Suzanne? In that
Yes,
zero?
yes. So the
22 field.
only, you're gonna have there's going to be 4-letter characters in your PDPM HIPS code. Now, for the first character is PTOT. The second character is SLP or speech language. The
Right.
third character is nursing, and the fourth is the non-therapy ancillary. The fifth
Correct.
character is going to be a 6, the number 6 that's going to be included on your claim. So in order to mask that code, anything other than the nursing PDPM nursing group is going to be changed to an A on your claim with a 6 at the end, and that's what you're going to submit as your billing code.
Gotcha.
I just want to double check. Is everybody able to see Catherine Gunn and Sue Panette's email? It looks like it was in a direct message, possibly, as opposed to everyone.
Oh, okay. Let me change that.
Happens,
Can
right?
I change that?
Okay, thanks so much, Sue. Great explanations. The next question we have, providers have also inquired about billing for bariatric residents. Can you please describe how that will be done? Thank you.
Well, what I have, the only item for the bariatric folks is still going to be that you still are going to have to get your authorization to actually show the need for the more staff. So none of those items are going to change. We would have to actually look at what the revenue codes, if there's anything going to change that way. I don't anticipate any of those are going to change, but if anyone else, if Suzanne has anything on it,
I think we
different.
have the revenue codes, right? I think we have the revenue codes for the tier 1 and tier 2. Does that sound right, Dwayne?
We do have the revenue codes for the tier 1 and tier 2 that will be used on when billing. Yes, they're out there with the rates. I believe we shared them, and they may be. Amanda, do you know if those are posted on the rate reform website? Because I know they were part of the presentation.
What was it you were looking for?
The bariatric revenue codes with the bariatric tiered rates.
I don't think so, but I can go check. I don't remember posting that there, no.
And as Bruce mentioned, it is a prior authorization. It's the same prior authorization process as has been used for everything else in the state. If there's more information needed on that, I guess that would be helpful to know, and we can share more either on the site or in an e-message. I know it's strongly preferred from the prior auth team to receive messages or to receive those prior auth requests through their prior auth portal, as opposed to with fax. Faxes are just less reliable.
Angela, can you tell us if that answered your question, or if there's still more information that you'd be seeking for that response?
Yeah, thanks, Dwayne. I think that helps to understand. It was a question that came to me from a provider, and I don't have a lot more detail, but I do recall, I think it was in the October slide deck, when Michelle Probert, Amanda's nodding at me, when Michelle Probert described the two tiers. I think there was a dollar amount mentioned, but I don't recall what it is off the top of my head. So if we could double check that that's posted somewhere public, that would be helpful. And I think the piece about the same prior authorization process should help answer that question, right? You need approval before you can bill for those residents. Thank you.
Yep, and we'll make sure that we communicate that, Angela, and get it posted somewhere, and we'll follow up.
Great.
Thanks
you.
for that. The next question, would you please go over the assessment, the 5th character of the billing code? Is it always to be a 6 on the UB? Would it be helpful perhaps to share the PDPM billing guide so that there's a visual reference for this with the codes? Would that be good?
I think so. Also to bring up the table, that's in that billing guide. Yeah.
Mandy, you have that ready to share? I can see her working on it.
I do.
Oh, you have it too? Okay. Well, now it's just a race.
Were you gonna bring it up, Mandy?
Yes, I can. I thought you said you were gonna do it.
Oh, okay, I do have it.
I can do it. Hold on. It's the share button. Oh, sorry, guys. Here we go for the codes.
Okay, can you see it?
We can. So the specific question was, you had mentioned, where was it? I answered it, so it's gone. It's about the 5th character, though. The 5th character of the billing code, is it always to be a 6 on the UB?
It is.
For main care billing, that would be correct. You still follow your regular Medicare SNF billing policy. That's not impacted here, but for main care billing, it'll be the 6, which indicates an OBRA assessment. And so just to reiterate too, so this is the nursing category of the PDPM group, and that's what these in the first column it's showing in the nursing category, and then it's showing the description, which that can look similar to the RUGs, but this is PDPM nursing component. And you can see here too, we have the case mix group that generally shows up with this PDPM group. We show you here the main care billing code that is the masked code with only that 3rd character highlighted here so you could see, the A on the first one, right? I'll use the B on the 2nd row there, AAB. So that is the B code that is part of the PDPM that you see from CMS, right? But this is masked with the A's and then a final 6 for your OBRA assessment indicator. Maybe that's helpful.
Let's leave that up for just a minute. Any follow-up questions around this table? So a lot of really great PDPM questions around this table. Oh, I see Mary. Go ahead, Mary.
Not necessarily on the table, but for the ZO250, is the case mix group here what you want in that ZO250 or the mask
The masked billing code.
and the ZO250?
Yes, please.
Okay, just clarifying. Thank you.
Thank you.
And I'm just seeing a couple of questions that have come into the chat. Again, just you want to try to use that Q&A function right at the bottom of your screen. It says Q&A, or raise your hand. It's really easy to lose the questions in the chat because, like in the chat feature, because we're not monitoring that. But this one is the main care portal set up to accept a claim with a 1/1 service date if we wanted to test a claim for a discharged resident?
Currently, what we know of it is not, so we would have you not actually test anything. I am waiting to get they were in the final test in as of yesterday to make sure, and I am waiting to get the confirmation on that one. If somebody is willing to do it, the ones that I think it was.
Well, I think we're in the testing process, right, internally.
Yeah.
And we did send out a notice to all providers to hold claims until 2/1 and until we send that message letting you know that the system is ready to go. At that point, the system will have been fully vetted and tested. Hopefully you've had an opportunity with your vendor to test claims up to the point of submission on the provider end. So no, we're not doing end-to-end testing with providers to make sure, but you can do testing with your vendor up to the point of submission. I hope that helps.
This is actually on the Health Pass portal, not any of the electronic claims.
Oh, okay.
Is what they were. The question was in regards to. Sorry to jump in like that, but that's what they were asking about. But that's what I'm waiting to hear back from. Whereas Carlene mentioned yesterday that it was in the sit testing, so it's not complete yet. So we're waiting to get the confirmation on that. And if they request to have one submitted, then I would reach out to one of the providers to ask you to submit something just on the portal. But I'm not going to do that unless I hear from our vendor of Gainwell that it's all complete to have someone test it.
Yeah, and we're not doing that with every provider. It'll just be like a small batch as part of the claims testing.
I can say, because I've just received an email from our vendor, that the testing that Gainwell is doing, it appears that when testing one of the codes, it did go through, approved, and the billing claim went through. So hopefully that means we're close, and we'll be able to bill close to the 1st of February, or providers will be able to bill close to the 1st of February.
Yep, and that actually answers our next question too, about when will main care be ready to accept electronic claims. Perfect.
So with this, I understand the billing guide went out. The billing guide was designed to give an idea of, or information on the billing process, not necessarily to be the exact rates that would be included in the system. So it's more for informational purposes with the table that's there. It would be the 2.914. That is what I sent to our providers. We typically go out 3 digits with these things. So I mean, that is my understanding, is that it would be the 3-digit number to the 0.914. And that's exactly what's on your rate letter. That's the rates that I sent over to be populated in the system for each provider. So I would go based on what's in the 3rd page of your rate letter, which shows the rate calculations per period, per HIPS group.
All right, the next one is related to this PDPM table, I think. Can you please confirm the case mix weight for ES3/AAAA6?
Sorry,
The
Amanda,
billing guide,
that's what I was just answering.
oh, that's the one you were just answering. Okay.
I will update this document if I find that another digit needs to be added.
Okay, I'm gonna keep taking the Q&A questions. This one just says, please clarify Z0250.
I think I answered that question. You
Okay,
want the masked,
this one just came in a minute ago, but if you want more clarification on that, because I know Sue has answered that. If you want more clarification, feel free to raise your hand and just ask a specific question. Okay, this one, can you clarify if the billing system isn't ready on February 1st? Will you have a plan to issue bridge payments? If our vendor isn't able to make the necessary changes in time, what should we do? This question, the answer to this one continues to be the same. We anticipate the system will be ready to go for billing on February 1st. All the claims testing has gone well. We don't anticipate a hiccup with that. So we don't anticipate a need for bridge payments. If something should arise, you know, there are systems in place and the powers that be will make sure to handle that if an issue comes up.
Can I jump? Can I add one thing? On here is if it's to do with your software and your software company not being up and ready or some issue on their end, then that would be something that you would either need to wait until they've got it fixed or enter them on the portal to make sure your claims do get submitted on there with no issues.
Oh, thank you, Bruce. This one says, I think I might have misunderstood Dwayne when talking about the CMI weights. Is what is in the table not correct? Vendors don't get the provider rates. So if there are different weights, we need to know what the final ones are so we can load them into our system.
So only that top code, the AAAA6 code, has a 4 after the 1. The rest of them all have zeros. And I'm going to combine my response for the other question that came in too. I would have to look at it to see if there's a calculation error here, where all of them are 0 except for that top code for the weight. I don't know if Catherine, you have that handy, where you can look at it.
We have been just using the rounded to 2 in these other reports, Dwayne, so we will need to update that. But and I can confirm that when I look at that, but yeah, I'll have to confirm that with you.
All right. I guess we'll get back to you on that question then, and have to look at it internally for updating it.
Okay, next question. Why is only the A main billing code is carried out to 3 decimal points on rate letter?
I combined that one with the previous one, Amanda, and answered both of them.
Okay, thank you. Can the Z0250 requirement information be added to the nursing home guide for billing PDPM nursing component final? We can certainly take that question into consideration and review with the team, the PDPM nursing component billing guide. And we will review that. All right, I'm going to go back through the chat and see if there is information in there. All right, we answered that one. Okay, I don't see any more questions. Oh, one just popped in. Yeah, great question. How will Maine communicate that they are ready to accept PDPM billing? Will there be a bulletin posted? Yep, as we mentioned, we will absolutely send out an e-message as we have in the past. So we will send an e-message when when the system is ready to accept claims. Okay, Sue, I think you can take that one down, dare I say, take a chance here.
I was gonna type an answer, but it has been answered.
I'm not sure if we want to circle back to Angela's question on the bariatric information, but I did post a link to that slideshow and indicated what pages that information was on. There was some dollar amounts in there as well for that bariatric section.
Thanks, Amanda. Okay, do you want to stop sharing, Sue? I think we've got this. You never know, we might get more questions on that, but we have a few minutes left. Do we want to, does anybody have interest in seeing a rate letter, updated rate letter example? I know we shared one last time. If that would be helpful, let me know.
Yes.
I know they've gone to the portal. Yeah, yep, okay. So we have a yes, couple yeses.
I need you to turn on sharing for me to be able to share a rate letter.
Gotcha. Here we go, Joy.
Can everyone see that?
Can you just click and drag your, yep, that's good.
So this is the second page of the letter, which shows the calculation. It starts with the HPD base direct care rate. The agency add-on is for the 20% contract labor agency staffing in year one before it drops to 10%. So we show the broken out effect of that on the actual rate letter. It then moves in to that final direct care HPD rate to compare to the comparison rate with the guardrails, which then carries down the appropriate rate down to line 3 for the HPD rate after guardrails. It's a similar process with the routine care, starting with what the 75th percentile routine care rate built in the model is, has the comparison rate, shows the guardrail effect, and then carries down that rate. And then it continues on to the capital cost rate before showing the grand total of the room and board itself. Which that room and board rate, going back to the question about bed hold days, that line 8 total room and board rate in this example of 222.78 would be the rate you build for the room and board days. Can you see the new file that I pulled up?
No, it's all black.
Yeah.
Okay, so it's blocking it. Okay, I'll have to stop sharing and reshare then. Oh, it's not allowing me to do it. Screen 3. Can you see that third page now?
Yep.
Okay. So this is the third page with the case weights. If you see that standardized, the rounding piece that we were discussing with the 2.914 versus the 2.91 and what Sue was sharing, we'll discuss that internally and get back to you on any changes that need to be made there or changes to the document. But this shows going from left to right, it shows the HIPS code to be used during billing with the 002 revenue code. It shows the weights, the standardized main weights, It uses that base rate up in the right-hand corner, in this case, the 244.86, and multiplies by the base rate to come up to the PDPM adjusted rate of 713.52. And then you have the VBP withhold that appears after that. In the first year, there is no withhold. That's why it's at 0%. Next year, in year 2, it'll be 1%. And every year after that will be 2%. It'll show the percentage on here and show a rate adjusted to remove that withhold in the far right column. So those are the components of the rate letter outside of the cover page, which I did not include here. The cover page does update to show once again the total rates on the face of the cover letter, which were taken away in our current system compared to what we used before that. If there are any questions on those, we can.
There's one rate letter question. One of my facilities shows a negative PDPM withhold. Is this an error?
And that's one of the ones I talked about earlier, where there was 5 facilities affected that we changed to rates today. Yes, that is an error. It shows because it shows negatives across the board, I believe, for the rate and stuff. That's the error we corrected. You should have a new rate letter that changed that on the portal today. That fixes that issue. It does not affect the rates that went into the system. It only affects the appearance on the actual calculation of the rate letter.
Perfect. Thanks, Dwayne. Can you confirm what cost report year is being used for capital costs in the new rate letters?
All the information used for the current rate model comes from the 2023 cost reports as filed, with the exception of new facilities that potentially would have used a pro forma.
Okay. Will new rate letter be issued if main standardized weight on ES3 8AA6 is changed to something other than 2.914, or if the other levels are no longer rounded off?
Yes, if there's a change, if there's any changes to what's on the current letters, it will be adjusted and changed on the rate letters, and we will send out new copies of those to providers.
Okay, thank you. How will that be communicated?
I mean, I think we probably communicate, with the MHCA like we have been. Additionally, we could arguably put out a e-message to notify all providers. But it would be through our normal, communication tools that we use with providers as is.
Perfect. Thanks, Dwayne. Can you repeat the response to what happens if the software vendor can't make these edits in time? Manual entry is labor intensive. Is there no other workaround?
There is no other workaround. It's either the only other workaround is, unfortunately, if you hold your claims and not submit anything. That's the unfortunate only way, is on the portal, or your vendor electronic software needs to be, once that's corrected, then you can submit your files if you don't want to do them on the portal.
Okay, thank you, Bruce. How soon will we know the CMI weights on rate letter? We are going with what is on the rate letter for now. Please confirm is correct to do this.
Yes, I would go with what's on the rate letter for now, until we make a change. That is what we sent over to the portal, so or to the configuration team to be entered into the system. So I would absolutely go with what is stated on your rate until that changes.
Great questions today. So, no other questions currently. We just want to thank you all again for coming. As we mentioned before, any questions posted in the Q&A that we couldn't get to, we'll be posting on the FAQ document. We'll be using all the questions answered to make an FAQ document as well. After this call, please direct any further questions directly to your PR or to Maine Healthcare Association, as we work very closely with them. Please check the rate reform website for the video recording of today's meeting to be posted by the end of the week and likely very much sooner. With that, we will wrap up. And yeah, Mandy just put in one thing.
I just reshared the rate reform link
Perfect.
again.
Yeah, so I'll give everybody just a second. Mandy shared in the chat, again, the rate system reform website. So if you want to click that and save that, that's where all these calls are posted. That's where the PDPM billing guide is posted. That is a really great resource if you want to click that and favorite it.
Amanda, we have another
Everybody's
question
got a minute. Question.
in the Q&A.
Okay, one last question. For the next issue of rate letter, not 1/125, will the CMI weight be carried out to 3 decimal points for all levels as it was in the past?
I mean, I don't think we're prepared to answer what's going to be on the rate letters a year from now. I think whatever decision is made with the current situation would probably be what's carried forward to next year, though. So if there's any adjustment needs to be made between what's on the rate letters now and what was in the document shared by Sue earlier, we'll update that if needed, but I would imagine it would stay the same from this point forward. If we do update to 3, it would obviously update to 3. If the decision is made to go to 2, it would reduce down to 2. I don't think we'll change it after we get it set up, in this first one.
Wonderful. Thank you. And we'll conclude again. Have a wonderful day, everyone. Thank you for joining.